Have you ever watched someone deteriorate from a disease or a chronic illness? Have you ever seen someone suffer from the pain of an ailment? Lose all lust for life because their spirit is broken due to the terrible side effects cancer or AIDS has on their body? Not only pain, but lack of appetite and depression. It is something that no one should ever have to live through, being sick or as a caretaker. Nationwide, heart disease, cancer, and chronic lower respiratory disease are the top 3 causes of death in the United States, affecting approximately 600,000 people a year. According to the Centers for Disease Control, $444 billion have been spent on heart disease. The cost spent on cancer has exceeded the amount spent on heart disease due to the different variances of cancer. Considering these are total costs, including surgeries, treatments, and more, you may be astonished to know studies have shown the annual cost for chronic pain is as high as $635 billion. This is more than the dollar amount spent on heart disease, cancer, and diabetes each year, according to Science Daily. Becoming increasingly popular is the use of marijuana for medical purposes, especially chronic pain and nausea. Marijuana costs are sufficiently lower than what we spend on heart disease, cancer, and chronic pain combined. Granted, medical marijuana is not legal in all states, and that average could grow as more states legalize the use of medicinal marijuana. However, the numbers would still be much more cost-effective if adopted nationwide. For years and years, codeine, morphine, hydrocodone, and Percocet, to only name a few, have been used to treat chronic pain. It has been found when narcotics are combined with marijuana, patients experience less pain. A study published in Clinical Pharmacology and Therapeutics confirmed the fact that when inhaled through a vaporizer and combined with morphine, patients who are chronically ill experience a 33% reduction in pain. Those who were prescribed oxycodone and combined this narcotic with marijuana saw a 20% decrease in pain. With further research, medical marijuana could help ease the pain of AIDS and cancer patients worldwide. This is a huge deal, considering that there are minimal side effects for marijuana. In addition, patients may be able to take lower doses of narcotics when combining them with cannabis. This is a praiseworthy goal, considering that narcotics are highly addictive and can even be deadly, especially when given in large doses. To put the icing on the cake, there have been no documented deaths caused by marijuana. Therefore, this combination could prove much safer than the way that the healthcare system is currently managing patients' pain. It has been known that chronic pain is one of the problems that the healthcare system is least capable of managing. Perhaps that is the reason why so many billions of dollars are spent annually on chronic pain. Instead of putting so much money towards the continuance of this type of management that isn't necessarily beneficial, they should be putting more money into further research to help legalize marijuana for medicinal purposes. For instance, one reason right off the bat is the fact that it is known that narcotics can cause a loss of appetite, a side effect that cancer and AIDS patients cannot afford, whereas marijuana actually increases a patient's appetite. Furthermore, it helps with many more ailments besides pain that happen to be experienced by chronically ill patients, such as stress, depression, anxiety, and insomnia. If all of these ailments could be treated by one medicine, marijuana, then it may give cancer and AIDS patients their lust for life back again, which is really conducive to their overall health. Another plus is that medical marijuana can be consumed in many different ways. For example, baked goods, smoking it, and inhaling it through a vaporizer. As stated on the marijuanaeffect.com, a vaporizer is less harmful than smoking marijuana because harmful carcinogens are not entering your lungs. Another benefit of a vaporizer is that there is no smell associated with the cannabis being inhaled through it. Some patients may be worried about the smell lingering, but vaporizers prevent that from happening. This is a photo of all of the different diseases and ailments that marijuana can help subside the symptoms, the side effects. All in all, medical marijuana would be much more cost-effective, healthy, and most importantly, helpful. I have watched a loved one deteriorate right in front of my eyes due to the effects of cancer. I can only help but wonder how much more relief they would have if they were able to utilize medical marijuana. Thank you.